Welcome to the Beverly Hills Plastic Surgery Podcast. It's holiday time. I'm here with my festive co-host, Dr. Millicent Rovelo. How are you doing?
I'm good. How are you?
Good. Are you festive?
I'm feeling pretty festive. You know why? Because this is the first year that I have gotten all of my Christmas shopping done, like in the first week of December. And because I'm such a Christmas nerd, I've really been able to enjoy the rest of the Christmas season.
That is very impressive.
I know.
I have done zero Christmas shopping.
Yeah, you're a little behind. But you know what? You still have like a week and a half, so you have plenty of time.
I'm good.
Yeah.
I will get it done. I promise.
I think every year I've known you, you usually get it done the day before.
I do. I'm like a December 23rd, 24th kind of guy.
Mm-hmm. Yeah,
that
the day
works.
before.
That is the day before.
Yes.
Well, today, at the suggestion of one of our star patients,
Very loyal listener.
we are going to talk about why we love plastic surgery, why we love doing what we do.
Why we became plastic surgeons. Yes, and why we love what we do. So it's kind of one of those things that you get used to answering when you go on interviews for different fellowship positions or job interviews. Like, why did you become a plastic surgeon? And we all kind of have these sort of memorized answers that roll off our tongue. But I have found that the more I do plastic surgery, the more the answer has kind of changed and become perhaps more authentic as opposed to just like a hoop jumping answer.
Yeah, I mean, I agree. I think the reasons I got into it really were about sort of the cool operations and the way that you take care of people and just the diversity of the operations. Those were sort of the things that made me go, man, I want to do this.
Well, tell me your story. So take me back to when you were deciding on what kind of a doctor you wanted to be or surgeon. Like, what was your path to this?
Well, in high school, one of my girlfriends, her dad was a vascular surgeon.
Okay.
He was an incredible guy, a guy named Bruce Brenner, and he was just universally loved and an incredible surgeon. He brought me to, I went to, take your favorite high schooler to work day with him, and it was great.
That's pretty cool.
It was super cool, and I just got totally into it, and that's what made me want to be a physician. And then when I was in college, I volunteered as an orderly at St. Barnabas Hospital near my house in New Jersey, and the first day I was in working as an orderly, they're like, hey, where's that kid from Vanderbilt? Tell him to get in here. And the neurosurgeons brought me in. They're like, put on some gloves. Feel this brain tumor.
Whoa.
Look. And so I'm like sitting there like, and yes, I'm touching a brain.
Oh, wow.
All of a sudden I was
cool.
like, whoa. So that got me into surgery. But then it was all about orthopedics for me and neurosurgery, orthopedics. I was about spines and about physiology and exercise. And so I went to Cornell, where the Hospital for Special Surgery is just huge. They had all the top sports guys, the guys that did that, the Giants team doctor, the Mets team doctor, the Yankees team doctor, like all these guys were there, and sports orthopedics was just the coolest. And as an athlete, I was really into it.
Right. But
then I kind of got into the soft tissue stuff, the hand surgery, and then I started seeing people getting reconstructed, and by third year I said, I'm going to do a plastic surgery rotation, and boom, that was it.
That was it.
Done.
You were hooked.
Totally hooked. First case, walked in. This guy's got an enormous abdominal hernia. It was skin graft over bowel. His entire abdominal wall was down at his pelvis. He'd had pancreatitis, somehow survived. His sump drains, everything, like in the
Abdominal
ICU
disaster.
for 16 months. Yeah. And we go in and we're like, well, we're going to get this. I remember the chief resident. It was Ciccarelli and DeBellis. They were the two chiefs at Cornell, and they're like, we're gonna get this abdominal wall up to these ribs, and we peeled skin graft off of bowel, and we unfurled these rectus muscles, and we looped big, huge 28 gauge wires around the ribs, and and I was just like, this is so cool. Like, I'm totally doing this.
It's really cool.
It's so cool. And I got hooked. Then I started learning about rhinoplasties and craniofacial surgery and Pierre-Robin syndrome and all these cases. I can remember them because I was so into it. I studied like crazy and lo and behold, got the residency, and here I am.
And here you go. So I think that's a pretty traditional story. I mean, I think we've sort of all found our way to plastic surgery. Maybe not all of us, but I would say my path was similar-ish. You know, I was that like weird little kid who knew what they wanted to do when they were 11 years old, because I don't like unknown. And I was like, well, I need to know what I'm going to do when I grow up, because I'm 11 and like the clock's ticking. So like, I remember
That's
lying
totally
in bed one night and like going through the list of options. Like, my dad's an accountant. I could be an accountant. I could be an actress because I really do like to act. Or I could be a doctor because that's a really reliable, dependable income. Acting's not so reliable. Accounting seems boring. I'm going to be a doctor. Like, that was literally my checklist. Age 11. Done. I'm going to be a
I
doctor.
could totally see that. My daughter would probably be like that too.
Yeah, I'm gonna be a
that's like
doctor.
a very Kate move too.
Right.
Just be like, okay, that's what I'm doing.
And here I am. So that was my path. I knew I wanted to be a doctor. I didn't hone in on exactly what kind, but I sort of knew by the time I was in college that I wanted to be a surgeon. I'd done some volunteering and internships with various trauma surgeons, and I thought trauma surgery was very cool. Like, I loved the adrenaline of it and the saving of lives and sort of just, you know, that intense nature of trauma surgery. So I went into medical school thinking that I was going to be a trauma surgeon, and that's sort of where I was up until somewhere maybe my second year, where we were watching a craniofacial case at Children's Hospital. Some kid was born with a very deformed skull, a craniosynostosis case, and they were literally reshaping the skull and recreating how his skull looked. And the rest of my fellow medical students moved on to the next case, and I stayed there for like the 6 hours and just finished watching, because I was like, I've never seen, like, same thing you did. Like, what is happening right now? This is the most incredible thing I've ever seen. And after that, same thing. I was totally hooked. Like, plastic surgery does the coolest surgeries. And it really was that blend of surgery, using your hands, which I really loved, making things, but then being able to use your aesthetic vision and your creativity to make every case unique. Because general surgery, you know, a hernia is a hernia, a gallbladder is a gallbladder. Making the diagnosis is the kind of tricky part in those cases. But once you do the surgery, like, it's more or less the same for every patient. But plastic surgery, it's a different procedure for every patient, because everybody comes with a different look and wanting a different look. So that's what I love, the blend of the mechanical and the hands-on with the like creativity that you can bring to each operation.
100%. And that's it. It's like, you don't have a blueprint for these operations. Even if it's a breast augmentation, which everybody thinks, that's easy surgery. It's not if you want it to be awesome.
Right.
It's not if you want it to be awesome. Now, if you want to just slam in some breast implants and open a pocket, shove them in there, and they look how they look, and you know that. And
Gross.
by the way, there are people that do that.
Yeah, I know.
Yeah. Right. And, you know, if you want it to be nice, then it's a whole different day. And that's what I love about plastic surgery. I see every time I walk into the operating room this is my opportunity to be the best that I've ever been. This should be the best operation I've ever done. If I'm doing a facelift, this should be the best facelift I've ever done. If I'm doing a nose, it should be the best rhinoplasty I've ever. That's the way I see it. Because why shouldn't it be? I mean, I have all my experience. I'm here today to kind of nail this thing for my patient and make it amazing. Like, what are you doing if you're not doing that?
I know. And I think that's what it is. We are constantly in competition with each other because our results are so visual. Like, again, a gallbladder is internal. No one really knows what you did. As long as the gallbladder's out and the patient's healthy, like, then you did a good job. But there's no real comparison between surgeons. With plastic surgeons, the results are there. They are out front for you and everyone else and your peers to see. So we are in competition with each other to have the best or the results we can get. But also, we're very much in competition with ourselves. Like, there's a reason that we attract so many neurotic type A personalities to this specialty.
100%.
Because we are like these innate, like, perfectionists that we constantly want to be better, like more for an internal reason than for anything else. And thankfully our patients benefit from that neurosis. But a lot of it is very much an internal competition.
Yeah, and it is about being the best that you can be for your patient, because there is no perfect in plastic surgery. It's almost like we've set ourselves up to definitely
to
be
fail.
unhappy.
Yeah, because you can't get perfection.
We're
You
definitely
can't.
going to be unhappy. And it's just a question of what degree of unhappy are we?
It's so true.
Yeah, because you can't, I mean, plastic surgery, there's always a way that it could possibly be better. In fact, we just finished this case just now, and I asked, Dr. Veranis, our fellow, I said, what could we have done better? How could how could it have been better? Like, this is great. It looks amazing. What could we do better? And we sat there and thought through, and we're like, nope, this is where we are today. Yeah. Now, 5 years from now, there's going to be some technology. Something's going to be better. But if you're not pushing the specialty yourself, and not just for yourself, but for the specialty, then you're not doing the job the way it should be done. This is all about being in constant ebb and flow of really learning to better your operation, to better your patient. Mm-hmm. It's one of the most, it's just a privilege to do this job.
Right. And I couldn't agree more. There are so many reasons I love this job that went beyond like the rote answers I gave when I was applying to positions. Like, I love plastic surgery because I can use my hands and I can be creative. Yes, I just said all those things, and that's still why. But what I can look back now and appreciate is that internal drive to be better, to have the better results, to give your patient the absolute best you can give, and then give the next patient an even better result, because we're constantly evolving and getting better techniques, both as a specialty and as individuals.
So what's your favorite operation?
I like a good breast augmentation. I enjoy my tummy tucks. And I'm really getting into the facelifts. Because I was like 3. See, that's the problem, right? Because like I can't pick one. I'm like, okay, well, actually, I kind of like doing that. You know what? Actually, there's like so many I can name. I don't think I have one. Like if you really said you can do only one operation for the rest of your life, I'd have a really hard time with that.
I'd have to do the pros and cons.
Yeah, it's tricky.
It is. It's hard. I don't know which one it would be, but my favorites are, since we're doing 3, rhinoplasty, facelifts, and then I love doing primary breast augs, but I really like solving the problems of problematic implants.
Oh, geez.
That's kind of my thing.
I know. I have that too. Those are stressful, though.
They're hard.
I mean, I think a primary aug is just way easier when you can do it right the first time. But the secondaries, I do a lot, but they are stressful to like really get them right. And those are the ones that I probably critique the most myself of my own results, because there's so many moving parts to those things.
Yeah, you have to. They're really tough. You got a lot of, and there's just, there's always a way it could have been better. There's something you could have done more. But you have to just understand that there's a point that you get to where you're like, this is as good as this is going to be.
Yes.
This is what I've got. Right. This is how it's going to be awesome. And it is. And then the patients are very happy. And then you and I both could go back on every single case we've ever done and point at things like, what could I have done about this? Mm-hmm. What could I have done about that? What could I have made this? And it's not that those can be perfect. They cannot be perfect. They cannot be perfect. Don't have plastic surgery if you want perfection. It isn't going to happen. That's not how this works. Right. You're not perfect to start with. You're not going to be perfect after. That isn't part of the deal.
Though sometimes we can get pretty close.
Yeah, we can make them. We make them awesome. Sometimes. That's for sure. So yeah, I think that's it. So in terms of what do you see for your future, Dr. Rovelo? I mean, you're cranking this stuff out. You've been in practice now for a good bit of time. You've got a ton of operating under your belt. What's the future for you? Is it more facelifts? Is it more?
Definitely more facelifts. More of everything. And for me, I just want to keep getting better. Every year, I just want to be the best. That's really all I want, is to just always be better.
That's how I see it. I mean, I literally evolve my operations while I'm doing them. I'm just like, I did this turn under flap this way last time. I'm going to do it this way this time.
That's the creative part of what we do.
It's so awesome. Yeah. It is. And that's why the results keep getting better and better. That's why, a lot of times you see people that are coming out and, you just know what kind of pain they're going to have to go through for the first 2-3 years of being out in practice, because you're just not ready for it.
I know it's a pretty steep learning curve. Thank goodness it's steep, because you do catch on pretty fast, but it is tough and it is painful, and it never stops. I mean, the idea is that you constantly keep going up that curve. But I feel fortunate that I get to do what I do. Looking back, there were at some many points in my life, I thought, well, I could also do this, or maybe I could also do this as a career. But now that I am where I am, I'm like, you know what? There really isn't anything else that I could do that I would love near as much. So I feel very fortunate that I have been able to do what I love, how I love doing it.
And there you have it. So happy holidays, everyone. Enjoy. That is our story of how we got to plastic surgery and why we love doing it. And we appreciate the input from our loyal patient and faithful listener. And this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.